Happy New Year, everyone. It's good to see all of you back. This is the first episode of 2022 for Talking Live with Macy. So it's the same drill. We're going to wait for 15 people to join us so we can get more people to tune in. And at least we know that there is an audience because we have a medical expert here today to be with us to hear and actually give us advice on menorrhagia or heavy menstrual bleeding. So if you're tuning into this, where please share this with your friends, with your family, so that they can come in and ask questions and also find out more about menorrhagia. If you don't know what menorrhagia is, it's heavy menstrual bleeding. So if you have friends, family you think or suspect that they might have this, I think it would be great to share this with them. So this is, like I mentioned, the first episode of Talking Life with Macy for 2022. I haven't seen you guys in almost a month, or maybe it's 3 weeks since the last show. And I'm so excited to see all of you. I know today might be a long shot, hoping that more people will join us, but I'll give it till maybe about 45 more seconds before I officially begin. So please, ladies and gentlemen who are tuning in right now, share this with your friends, with your family, get them to tune in so that we can actually talk and have a great discussion on menorrhagia, heavy menstrual bleeding. And guys, this would be a good opportunity for you to find out more as well. I know that there's some of you already tuning in. Hi, Chick Bushro. Happy New Year to you. And also to Nitya. I'm so glad to see you. I know that there are some cancer survivors, cancer patients joining in today. Even I myself did not know what menorrhagia was until I started doing this show. So I'm truly looking forward to today's session. Once again, we're going to aim for 15 before we begin. It looks like we are almost there. I will officially begin now. So, Happy New Year to all of you. It's a brand new year, 2022. We hope that this year, COVID 19 will truly be an endemic rather than a pandemic. And I would like to wish all of you a great year filled with success, happiness, and good health, I think most importantly. There's so much to look forward to after 2 years of post lockdown, of lockdowns, semi lockdowns, on and off here in Malaysia and actually worldwide. I know the big O is doing its rounds worldwide, but of course, our aim is to try to stay as healthy as possible. So I wish all of you a great year ahead. Now, I'm back here today because of all of your support, tuning in almost every Sunday for the past 2 years. And all of you voted for me to continue talking live with Macy, and that's why I'm doing it. So today is a very apt episode to begin the year because we're going to talk about something a lot of women have but don't know they have. So today we'll talk about menorrhagia. That affects about 9 to 30% of Malaysian women and 9 to 15% of women in North America and Europe. And these statistics vary because it depends on the age. Many women actually, like I mentioned, don't even know they have menorrhagia, and that results in a lot of women suffering in silence. To be honest, I myself actually found out I have menorrhagia, and that was only recently. So, menorrhagia is menstrual bleeding that lasts more than 7 days, or heavy bleeding, where you have to change your pad every 2 hours. The good thing is that there are treatment options available, but we as women must find out and be aware of this problem. So, today, we have Dr. Rama Krishna, a consultant gynecologist and obstetrics at Columbia, Asia, at Bukit Rimau to share more with us on this condition called menorrhagia, or rather heavy menstrual bleeding. Hi, Dr. Rama. Thank you so much for joining us.
Hi, good afternoon. Hi, thank you for
Hello.
inviting me. Yeah.
Thank you for joining us. Today is such a niche topic, so mainly for females. But if you're a gentleman tuning in today, please also share this with your female friends and family. So, Dr. Rama, I think the first very simple question is what is menorrhagia, or rather heavy menstrual bleeding?
As what Maisie said just now, yeah, menorrhagia is heavy menstrual flow which lasts for more than 7 days, or you change the pad every 2 to 3 hours. Okay, basically your pad will get soaked. Or if you want to quantify the loss, we normally say it's more than 80 ml per menstrual cycle. If generally you all will lose around 20 to 40 ml of blood loss in a normal menstrual pattern. Normal menstrual pattern is anything between a cycle of 21 to 35 days, and your menstrual flow will be lasting between 4 to 7 days. Okay, so when you lose more than 80 ml of blood in one cycle, that means it's defined as menorrhagia.
I see. So I think earlier you mentioned that you wanted to let us know more about the uterus and how menorrhagia actually happens. So
Yeah.
what are the causes or risk factors to develop menorrhagia?
Okay, I think all of you know what is uterus. Uterus has three different lining, and the blood comes from the inner lining, what is called as endometrium. Okay, endometrium is the lining where the blood flow comes out. Okay, so generally, when we want to talk about the risk factors and cause of the menorrhagia, we divide it into issues pertaining to the uterus as such. Okay, so that's one part of it, and the other part is other conditions which can lead into heavy menstrual blood loss. Okay, so most common causes of uterus causes are if you have any polyps inside the uterus. Polyps are something like pimples, but they grow inside the uterus. Okay, and other common thing is fibroids. Then another condition called adenomyosis. Adenomyosis is swelling of the overall uterus. Normally, this is more common among women who have given birth. Okay. What is adenomyosis? Adenomyosis is basically migration of the inner lining of the cells inside the muscle of the uterus. So this muscle of the uterus becomes enlarged and the uterus becomes much bigger size than normal. So when you have menses, the menses cannot be stopped because the uterus cannot contract fully. That's called adenomyosis. And another cause of heavy bleeding from the uterus is, of course, any cancers to the uterus or the cervix. Okay. Then, besides this, the other most common cause of heavy menstrual blood is when you have hormonal imbalance. This is one of the most common cause where your hormones, the lady hormones, the estrogen and progesterone, they are imbalanced or they are not means they're not aligning. See, they have a pattern in a month in a menstrual pattern. There is a where the estrogen goes up, then progesterone comes down, then progesterone goes up. So there's a way how they behave. When they behave abnormally, then they won't be able to control the bleeding of the uterus. That is the most common cause. That's hormonal. After that, we have other medical conditions. If you have any issues regarding your bleeding or clotting, that means your blood cannot clot easily. Even these patients can have heavy bleeding. Okay, then other than this, then if you have thyroid problem also can cause heavy bleeding. Okay, so these are the most common causes, and the best part of all this is nearly 30 to 40% of the times we won't be able to identify a cause specifically why this lady is having heavy menstrual pattern.
I think more importantly, Dr. Rama, besides the cause, right, is the fact that many women are not educated that
Yes.
menorrhagia is a condition and it is a problem. It could be a problem that and it could also be treated. So I think that's why we are having today's discussion. Um, I know many of you have questions for Dr. Rama, and today is a Sunday, so we'll try and make today lighthearted, where you can also ask questions towards the end, as usual. The next question, then, because a lot of people don't know what menorrhagia is, are what are the symptoms associated with menorrhagia?
Okay, before I go to symptoms, let us just describe to common people that, see, if you have certain type of pattern in your menstrual cycle, that means normally, let's say every month you get your menstrual cycle 28 to 30 days, which is the most common, okay, and you bleed for around 4 to 5 days or even up to 7 days. That is your normal pattern. And generally, you will also have a pattern of how many pads you change per day. Okay, generally you change 6 to 8 pads maximum. Okay, but means if you're talking about heavy menstrual bleeding, your pads will be getting soaked when you're sleeping itself. You have to get up to change the pad, or you have any kind of blood clots, big blood clots coming out. This is not normal. Okay. So when there is abnormality or change in your menstrual pattern, which shows that it is not your usual pattern, I think you should seek medical advice from your gynecologist or any doctors. Okay, that is how you identify the problem. That's one thing. Then, okay, we talk about uh, uh, you. You wanted to you asked me something. Sorry, I missed the question.
I wanted to ask, I think you already went through it, like in terms of the symptoms associated with
Okay,
menorrhagia. Uh, as you mentioned to me that you do see a lot of patients with menorrhagia, how many patients do you typically see with menorrhagia, and is it common?
okay. Generally, yeah, yeah, I see around 300 to 400 patients per month in my outpatient. Out of that, around 5% of them are menorrhagia. That
Wow,
means typically I see at least
20?
one or two. Yes, correct. Around 15 to 20 cases per month. Okay, and that is the figure. Means the figures are very varying according to different countries, different places, and all that. But generally, that is the figure. 3 to 5% is related with abnormality in the bleeding. And out of 3 to 5% abnormality in the bleeding, 60 to 70% are menorrhagia. Okay. And other symptoms, what you have to look for. See, sometimes you might just say, okay, this is still normal. Or you ask your friends, or you ask your mother, or you ask your sisters, they say, oh, this is okay. You're having very good flow. That means it's very good. That is not that. But other associated symptoms will be anemia. Anemia means loss of blood. That means your body is losing blood more than what it's supposed to be. You cannot maintain the hemoglobin. Okay. Then with that, you'll start having symptoms like lethargic. You feel lazy. You feel means easy fatigue. That means you'll start becoming tired very soon. If you go up to stairs or you do hiking and all that, you're unable to do it because you'll be gasping for oxygen and all that. So this is already severe menorrhagia. That means that it's already led to loss of blood in your body.
I see. So people with anemia are considered, I mean, like, it could be due to menorrhagia.
Yes.
Okay. What kind of lifestyle disruptions do people with menorrhagia face?
Okay, most common disruption is it's one thing is prolonged period. Okay, no one wants to have period in a month. They go up to 2 weeks. They have to be on pad and not able to do their normal routine and all that. That disrupts their normal lifestyle. Okay, on top of that, what happens is once you have anemia, that means you become weak, you can't do normal routine things, you
Hmm.
can't exercise well. All this will definitely reduces the quality of life of a woman.
Yeah. I think also, I just want to clarify something, and it's a myth. But I remember I was just talking to Dr. Rama about this. A lot of Asian women, be it Chinese, Indian, Malay, the thing about us is that our parents, our moms always tell us, like, hey, if you have heavy periods, you have periods regularly, it's a good sign, you're very fertile. That's what my mom told me. And I think she's watching this now. But it's not true. Now I find out that menorrhagia is a condition, and it could be due to those many factors that Dr. Rama mentioned, and it could be a problem.
Yeah, and one more thing, especially uh, people who are more pious or especially Muslim women, okay, they find it is very difficult for them to go with their regular prayers because if you are menstruating, normally you can't do prayers and all that. It goes same to I think Buddhist and Hindu women too. That's one thing. So that and one more thing, let's say you are in a still very good reproductive age group, sexually active, that also disrupts your relationship with your husband because means all these are social factors which are very very important in our daily routine.
Yeah, that's true. So, like, when it comes to besides lifestyle, then how is menorrhagia treated? Of course, women with menorrhagia, such as even myself, I would like to know, how do you treat it?
Okay, menorrhagia. Treating menorrhagia is not a biggest problem for nearly 90% of them. Okay, we have various medical treatments available. To start with, even simple Ponstan. I think everyone knows what is Ponstan. Ponstan, we take it as a
I
painkiller.
love Constant.
Okay,
I take it
Ponstan.
so often.
Yes, Ponstan itself is a treatment for menorrhagia. If it's a simple menorrhagia, Ponstan has a property of reducing the blood flow. Okay,
Oh, I
then we
didn't
have
know that.
yes, then we have another antiplatelet group called tranexamic acid. These are non-hormonal. Then the major treatment of medical treatment is through hormones. There are various hormone tablets which are available. Simple to say, yeah, contraceptive pills are one of the ways to treat menorrhagia. Okay,
Okay.
then we have other devices. These devices like your IUD. Let's say you don't want to get pregnant and all that, we put IUD and all that. There are IUDs with hormones inside where we insert in the uterus. This can we also use as a treatment for menorrhagia. This is medical treatment. Then of course we have surgical treatment. Before I go to surgical treatment, the surgical treatment are basically okay. First, most important thing, we have to make sure that we identify what is the cause of menorrhagia. And like what I said, around 30 to 40% we won't be able to diagnose it. But before doing any kind of treatment, we have to take a biopsy of your inner lining of the uterus. How we do that is either we insert a small camera inside the uterus and take some tissue and we send to the lab, because you also can have other conditions called endometrial hyperplasia or endometrial carcinoma and all that. We have to make sure we treat that, because the treatment for cancer is totally different from treating simple menorrhagia. Okay, so then we have another new way of treating now. Okay, to put it in a very layman terms, we basically laser the endometrial lining, or we microwave the endometrial lining, or we heat up the endometrial lining. We just burn the endometrial lining by using a hot saline. Okay, then of course the final resort is when we can't treat with all this way. What we do is we do surgery. So surgery means removing the womb. We call it hysterectomy. Okay, this is how normally we treat menorrhagia.
So I think first I would like to say that I think many women here, every time when you think of taking Ponston, they are told by their elders like, don't take Ponston, it's bad for health. I think this is a very Asian taboo thing once again. So a lot of people rather just suffer in silence and hold the pain rather than doing anything about it. And then now, like you mentioned, that there are other treatments such as hormone treatment. You can also go for laser treatment. So, what is this laser treatment called? Is there a
Uh,
scientific name for it?
yeah. Thermal ablation. It's called thermal
Thermal
ablation.
ablation.
Thermal means heat, and
I
ablation
see.
means destruction of the any kind of tissue. Okay,
I
so
see.
that is what I was talking about, thermal ablation. See, end of the day, as far as possible, if you already completed your family, you're more than 40 years old, and you don't want to conceive anymore, and you still want to preserve your uterus, thermal ablation will be one of the best choices, because your uterus is there. Because I think again, Malaysian thing or Asian thing, the sentiment of removing the womb is there. You
Yeah.
become, I mean, the psychological feeling of lesser womanhood by removing the uterus definitely is there, and it can lead to other issues like psychological issues and all that. So before resorting to removal of the womb, I think thermal ablation will be a good choice, if provided the lady is no more planning for children, and we know the cause of the menorrhagia is just hormonal, or we call it DUB. DUB means dysfunction uterine bleeding.
Mm.
Dysfunctional uterine
Okay.
bleeding. That means we are not able to identify exactly, but there is no other medical condition which is leading to the menorrhagia.
So, thermal ablation, or rather thermal blade, seems like an effective treatment to administer, and it has benefits, especially the fact that we don't need to remove the uterus, which is, I admit, for a lot of women out there, it would affect a lot of women psychologically. So, what are the main benefits of using thermal ablation?
Okay, the main benefits are it's a very simple day care procedure. It is around 10 to 15-minute procedure, which we normally do in in Malaysia. We do it in operation theater, but it's something like daycare. That means you can get admitted in the
I
morning and
see.
you can go back by afternoon. That is one advice. Second thing is it is not very invasive in the sense that we have to cut through or do a surgery for the women. And if the issue is with only endometrial lining, definitely thermal ablation should be a choice before resorting, because hysterectomy has its own complications.
Yes, yes. In terms of hysterectomy, that means you need to go for like hormone replacement after, right? If I'm not
Yes,
mistaken.
correct.
Okay. So, what would your advice be? Before that, for those of you females who are tuning in and have been waiting so long for this session since I've been advertising about it, you may start asking questions now because this is my last question for Dr. Rama. So, if you guys have questions about what we mentioned, the treatment options, the causes, the psychological effects of a hysterectomy, please go ahead and ask them to Dr. Rama. Put in your question so I can pick it up right after my final question. So, Dr. Rama, my last question for today's session is, what would your advice be for females who are experiencing menorrhagia?
Okay, the most important thing. So sometimes I feel very sad when I see a lady comes in, the hemoglobin has dropped less than 6 grams. Okay, that means she comes in, she's not able to perform her routine duties and all that because her blood levels are very low and all that. So don't wait till, if you have abnormality or abnormal pattern in your menstrual cycle, please come and see your doctor, or at least go and see a general doctor. Let the general doctor assess you and see whether actually you are suffering from menorrhagia or not. Because if you come in a very late stage, you need blood transfusion, you need admission,
Mm.
a lot of things. So this is a condition which can be treated very easily. So it's always good to seek treatment early rather than waiting means just waiting and waiting and waiting. Because sad to see, even now we see easily, last month itself I saw around 4 of them came, the hemoglobin is less than 5. We need to give blood transfusion, then we have to top up, then after that, so like that. So please don't wait. If your menstrual pattern is not good for 2 or 3 months, please come and see doctor.
So, but the thing is, what about people who are teenagers, like, and they have this and they don't even know that it's a condition? I think a lot of people suffer from it and they don't even know.
Yeah, definitely. Because again, when you talk of hormonal disturbances in the menstrual pattern, the most common group which is affected are ladies who are more than 40 years old before perimenopausal group. That means before they attain menopause, they'll have a lot of hormonal fluctuation. This will lead to abnormality or heavy bleeding. And another group which will have this abnormal hormonal pattern is teenagers who just attained menarche. That means who just started having menstrual cycle. This is another group which always comes late because they are not able to express it well. So the mothers have to take the role. The mothers should know how your daughter is having a menstrual cycle, whether she's having heavy, because you are the one who are providing the pads and all that to her. From there itself, you can always roughly estimate whether your daughter is having normal pattern or heavy pattern and all that. So so these two groups are the vulnerable groups. So it's very important to make sure. If not, the young girls will be suffering for many 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 years, and that might also affect their fertility and all that.
Yeah, that's true. I mean, because you mentioned about the risk factors and the causes. So, for those of you who are tuning in now, I think all of you said that some of you mentioned that you're excited for today's session. So, do you have any questions for Dr. Rama? Because I'm done with my questions for today. I hope that all of you have gain quite a lot of insight on what menorrhagia is, or rather heavy menstrual bleeding. And if you were tuning in to find out whether you have it, I think this was a great session for you. So, for those of you who are tuning in to find out more about menorrhagia, heavy menstrual bleeding, we talked about treatment options, we talked about causes, we talked about risk factors. Do you have any questions for Dr. Rama, or did we cover all of those completely very well? If not, we will be closing the session soon if you don't have any questions. So, to the ladies out there, please do ask any questions you have before we close the session. Or if you are a bit shy, you could always text me, and I will also put the question forth to Dr. Rama. And he said he is so kind to actually, he told me that he will be answering them. So please share your questions with me. And for those of you who have questions now, I'll give you guys about maybe 30 more seconds before I close off today's session on menorrhagia, or rather heavy menstrual bleeding. Like I mentioned earlier, we talked so much about what menorrhagia is, how it happens, the risk factors, the causes, what will happen to women who have it, the lifestyle disturbances, and more importantly, the treatment options. There are various treatment options, starting from constant, which a lot of our elders tell us don't eat it, it's bad for health, all the way to hysterectomy. So, and we also talked about a treatment option where you don't have to remove your uterus, which is thermal ablation, or rather thermoblade. And Dr. Rama has actually been using that quite often. So it's so much insights that we've gained today. So I guess many of you don't have questions today. We've covered a lot and it was very clear. Or I'm not sure whether you guys are shy. So just drop me a text or a message if you have questions for Dr. Rama, and I'll put it across. Thank you so much, guys, for tuning in this Sunday. I know it's almost the first weekend of the year as well. I would like to wish all of you a happy 2022. And my next session, actually, I plan to talk about vaccine boosters. And I know there's so much confusion, complications, or rather questions about it. So I plan to have that at my next session. So stay tuned to the page to find out when it will be, and join us then. Thank you so much to all of you for joining us. Have a good Sunday ahead. And more importantly, thank you so much, Dr. Rama, for being on the show.
Yeah, thank you very much. I thank you. Last takeaway message:
Yes.
women, please do your regular ultrasound, because 30% of you will have silent fibroids. Fibroids is one of the causes of menorrhagia, common cause. So doing ultrasound regularly is very important. Seeing your gynae and doing pap smears are also important. Thank you. Thank you. Have a nice day.
Thank you so much, Dr. Rama, for staying with us all the way till the end. Thank you so much. You've been such a great help and provided us a lot of insights. And thank you all for joining us. Thank you once again, and I'll see you in the next session.